So in this discussion, we're going to involve the both distal and proximal intersegmental motions and how they might influence the knee. So here we're going to talk about tibial motion, and we're going to focus on the influence of foot positions or subtalar joint pronation, supination on the tibial position. So typically, abnormal foot pronation has been linked to patellofemoral syndrome, but not necessarily with the tibial rotation. It's more thought to be linked to the knee varus valgus position that might occur. So we know that the knee valgus position can contribute to these higher stresses, especially in the lateral side of the patellofemoral joint. So if we have some knee femoral adduction relative to the pelvis, that's the basically hip position, as a result of the moments that we've been talking about, that could be a negative. Tibial abduction relative to the tibia, relative to the femur, so now we're talking about tibiofemoral joint, is connected to foot pronation. And so there's the potential that some orthotic treatments may improve this alignments somewhat. Here's the abnormal positions we've been talking about in terms of hip abduction, adduction, and internal rotation, and the same thing here during stairs. But then distally, you can also see the foot position where the foot's everted relative to the tibia, and the same thing here. So in this study by Nakagawa et al. In JOSPT in 2012, we see that there's ipsilateral trunk lean, contralateral pelvic drop, hip adduction, knee abduction in females. There's more hip internal rotation and less activation of the glute medius, all in patellofemoral pain syndrome participants compared to controls during a single leg squat. So all of these abnormal positions or kinematics at the knee and hip were typical of these injured patients, and they had 18% less hip abduction strength and 17% less hip external rotation strength. And so we can see here, if we looked at the hip internal rotation strength, it was even compensated in the opposite direction in the females. So we have hip internal rotation strength here on the Y, and then the females with patellofemoral syndrome here with the highest internal rotation strength. The males with patellofemoral syndrome were similar to both genders of the control participants. So this suggests almost like a muscle imbalance type problem where they had weak external rotators in terms of the females and strong internal rotators. So the bottom line is all of these factors, both proximal and distal, could be improved to help people with patellofemoral pain experience less high contact stress points at the patellofemoral joint and potentially decrease their overall pain problems. So interventions targeted at either end of the kinetic chain may have similar overall effects on lower limb motion and therefore clinical outcomes.